If you've got sagging of your upper eyelids, then this segment is for you. Sagging of the upper eyelids is typically caused by excess skin of our eyelids, and sometimes it's genetic, and other times it gets worse and worse as we get older, sometimes to the point where we actually have a problem with seeing. There's so much extra skin kind of hanging over our eyelids. Well, if you watch the introduction to facial plastic surgery, you learn that one of the only situations where surgery is the absolute best option is when you have excess sagging skin. There are no creams that can get rid of this sagging skin of the upper eyelids. No injections can do that. Even laser treatments are not effective really in getting rid of that extra skin. And so if you've got problems with excess skin of your upper eyelids, if the skin's kind of hanging and draping over it, then the only real good option for you, unfortunately, is surgery. But the good news is the surgery is a very straightforward and very, in general, simple one. So the surgery is called an upper blepharoplasty. And during an upper blepharoplasty, typically when I perform it, we perform it under either a general anesthetic or a sedation. I make an incision in the crease of the eyelid, okay, and then literally cut out the excess skin. Underlying that skin is a thin layer of redundant muscle that you don't need, so that is removed as well because that just adds fullness. And if we need to, sometimes we'll remove a little bit of fat from either the inside of the eye here or right above it. Okay, there are two little fat pockets here and here, once again in the inside of the eye or above it, that we can remove to help open the eyelid up. The fat removal nowadays is quite minimal. We usually don't remove much fat because we don't want to hollow out the upper eyelid. But anyways, this procedure once again is performed under a general or a sedation. It takes about 45 minutes to an hour where the skin is removed and once again a little bit of the muscle and the fat. And then I use one long little stitch to put things together. Now you do get a scar, and you can see on the diagram here on the left side of the screen in general how the marking goes. And that does leave a scar then in the crease of the eyelid and sometimes out extending into a little bit of the crow's feet area. Now if you're wondering why sometimes a scar goes out here to the crow's feet to the side a bit, it's because some people have a lot of overhanging skin way on the side, and in order to get rid of that skin, the scar has to be extended a bit. Now it's important to realize that these scars are permanent. They will never disappear. When you're 95 years old, those scars will still be there. But the good thing about the upper eyelids is that they typically heal really well, and it's extremely rare to have a scar that gets thick or that's even visible, especially when your eyes are open. Usually I tell patients that those scars are visible typically if your eyes are closed and somebody looks really closely at you, they may be able to see it, but usually it heals really nicely. So those are where the scars are. Now, what are the risks of the upper blepharoplasty? Well, the risks of the surgery, basically bleeding and infection, those are very rare. Virtually everybody gets some bruising, and we'll talk about swelling in just a little bit. There are risks of damage to some of the inner structures of the eye where maybe you can't open your eye quite as much as before. Extremely, extremely common. I'm sorry, extremely uncommon. Take that back, extremely uncommon. Not something that I typically see in my practice. There's always a potential risk that you may have a little extra skin left over on one side or the other or both. It is not that difficult to take a snip of extra skin if needed later on, potentially in the office. Although ideally, obviously, we want to get as good of a result the first time as possible. There are risks that the eyelids may look a little asymmetric. Sometimes having the eyelids done, you start noticing asymmetries that you didn't notice before, and this is something that we would talk about in a face-to-face consultation. So as far as the recovery, once again, the surgery itself is about 45 minutes to an hour operation, typically done under a sedation or under a general anesthetic. You head home from the operating center about half hour to an hour after the surgery is completed, and then you put some cold pads over your eyes. Okay, and we have you put the cold pads over your eyes typically the first 48 hours or so. What I recommend for my patients is you get a bowl of ice water, take a nice soft washcloth, dip it in the ice water, wring it out, put it over your eyes. And you want to do that and change that maybe every half hour, and ideally do it for the first 36 to 48 hours to help soothe the eyes, decrease swelling. You can get the area wet and shower and stuff typically the day afterwards. That's not a big deal. Most patients with this type of surgery don't take any pain pills. It's not considered a painful operation. If you're having pain, it's a reason to call me because we want to make sure that there's nothing wrong. The most feared complication from eyelid surgery is called a retrobulbar hemorrhage, and that's bleeding behind the eyeball that can be very, very dangerous. It is extremely, extremely rare to happen. Well, first sign of that, however, quite often is pain and excessive swelling on one side and not the other. So if you're having something like that, definitely a reason to contact us. But once again, extremely, extremely rare. So most people find that they don't take any pain pills after surgery. They're feeling good. They've got some bruising. You probably want to wear some glasses around so people don't see your eyes for a little bit. You come back to see us in our office at about a week after surgery. There's one long little stitch basically in each eyelid that we'll take out at that time. You'll probably still be a bit bruised there. You'll be definitely a bit puffy. Usually takes a good 2 weeks to really start looking good, although it will take 6 to 8 weeks for most of your swelling to go away, and it will take 4 to 6 months for all of your swelling to go away. So that does take a bit of time. Those scars can also take a long time to mature, anywhere from 6 to 12 months, although once again you may find some bruising and swelling for the first week or two, starting to look pretty good within 2 weeks, and most people look good within 3. Most of the swelling gone within 6 to 8 weeks. And this is what I call beginner's facial plastic surgery. This is for those people who say, look, I want to turn back the clock, but man, a facelift scares me, a brow lift scares me, fat injections, it scares me. What about just getting my eyes done, my upper eyes? Very simple operation, and typically people do really well with it. So let's look at some before and after photographs. This is a patient that I performed the upper blepharoplasty on. You can see her before and after, and a nice result. Not anything crazy. She doesn't look weird or anything like that, but a nice result there. Another patient here, you can see that on her before photo on the left, she has some excess skin of the upper eyelids. On the right, the eyelids just look more open. You can see more of the eyelid now. In this patient, you couldn't see her eyelids before, and she's relatively young. Afterwards, we opened the eyes up so you can see them again. Okay, and so this is what we try to look for. This is a gentleman who had it done, and so men, I'm very cautious in men. Okay, this surgery really is patterned after the female face, and so if a doctor performs this surgery the same in a male as they do in a female, you could actually end up causing that male to look a bit feminized. And because of that, I'm a bit more conservative with men to try to get them a good result, but not looking overdone. And another example of a male, real heavy upper eyelids, just open them up for him. Once again, he still looks masculine. He just looks more refreshed, and hopefully you would agree with me with that. I also want to throw in here too that if you are a bit older and if that skin is so excessive that it impinges on your vision, you literally, let's say you're driving and you can't see the lights above and you're missing traffic lights and things like that, then you may be a candidate for an insurance-based upper blepharoplasty. So health insurances might pay for your blepharoplasty if you've got visual field obstruction, if you can't see that well because there's so much hanging skin over your eyes. They won't pay for it if you don't have visual field obstruction. That is purely cosmetic. But if you're typically, the usual setup with this is somebody who's quite a bit older, and a lot of men especially, where that skin is just overhanging and you literally can't see that well, then your insurance may cover it. So talk with your insurance carrier if that's the case. I myself am not taking new insurance patients for this surgery, but once again, that's something that you may want to consider. And if you do, we're happy to refer you to some very well-vetted plastic surgeons in the area who can perform that procedure for you. So this is the treatment, the only real good treatment for sagging of the upper eyelids, and it unfortunately involves surgery. The good news is that the upper blepharoplasty surgery is one that is relatively straightforward. It's very well tolerated. Time off is typically minimal, and the pain is minimal as well. So a great surgery, a very nice surgery for somebody who's a little skittish, but man, you've got that puffiness or that excess skin of your upper eyelids. This is a way to treat it.